I think we're going to go ahead and get started. If our speaking participants can go ahead and come over here. Yes. All right. So thank you everyone for being here this morning. A couple things. I'm Gary McCoy, Director of Policy and Public Affairs for HealthRIGHT 360. We ask that everyone please keep their masks on. We will only have the speakers up here that are speaking as they're speaking, having their mask off. We've got some air filters in here, but as much as you can, please keep your distance. And with that, I'd like to go ahead and invite up Dr. Vika Eisen, CEO of HealthRIGHT 360.
Thank you all for coming today. Thank you all of our esteemed guests for speaking today. Welcome, I'm the CEO for HealthRIGHT 360. If you came here today believing that tired old trope about San Francisco is ungovernable because we can't agree on things, you're not really going to hear that from me. If you think I'm going to defend the status quo in the Tenderloin, well, I hate to disappoint you. No one here can make a case that the Tenderloin is fine just the way it is. People in poverty, people without enough food, people without homes, people using drugs on the streets, crime. It doesn't work for anybody living in the Tenderloin. It doesn't work for the elders, it doesn't work for children, it doesn't work for people without shelter, and it doesn't work for people using drugs on the street. I think on this, we all agree. So if we can pass the superficial soundbite of progressives versus moderates or whatever binary construct people make of this conversation, let's talk about some solutions. Let's be wildly innovative and creative in supporting a safe and healthy Tenderloin community. If we want people to stop using drugs on the streets, let's give them places to use drugs indoors, supported by teams of people who can make sure that they don't overdose and connect them with care and services. We have been talking about this for years now, and I mean years. Let's do it like yesterday. If we want to not see an increase in people living outdoors, well, let's not close the shelter-in-place hotels. If we want to connect people on the streets to care, let's try a thoughtful, compassionate outreach program like SF CART. And if we want people to stop dying from a toxic drug supply, let's pilot a safe supply program for people who use drugs, like the program that's established in Canada. And if we want to decrease crime, let's expand the Dream Keepers initiative here in San Francisco. See, we have lots of ideas. There's no lack of ideas. You know, I have been at this work caring for people who use drugs for a long, long time. And I see this counterproductive dichotomy where it seems like the only two solutions are lock them up or don't lock them up. That's it. No real, thoughtful, long-term investment in strategies in the middle. And if you say San Francisco has spent X billion dollars on social programs, I will challenge you by saying, well, what are we doing that is different from what we have always done? And how do we stop and make modifications along the way when the circumstances and situations around us change and when conditions change? Because a problem is complex does not mean that it is not solvable. It requires a flexibility in thinking. We can do this. I know one thing for sure. The war on drugs has produced exactly the conditions that you see in the Tenderloin today. Having contributed to mass incarceration and generational carceral trauma and the dehumanizing conditions for so many people in the Tenderloin and other poor and notably Black and brown communities in San Francisco. I look forward to working with the mayor and all of our community partners to support and improve the health of all San Franciscans. Thanks.
Thank you. And next we'll bring up Board President Siobhan Walton.
Thank you, Gary, so much. Thank you so much, Dr. Eisen. First of all, I just want to say good afternoon and start off by saying that Supervisor Ronan apologizes for not being able to be here as she has to tend to a family matter. A little while ago, the Board of Supervisors, led by Supervisor Haney and working with HealthRIGht 360, passed a resolution urging declaration and declaring the mayor to declare a state of emergency around overdoses in this city. That was not intended to increase law enforcement budgets here in San Francisco and arrest people who use drugs when we currently don't have adequate resources to address their needs. And there has never been a period in history where you could ever arrest your way out of addiction and mental health. We know that doesn't work as a strategy. People need a myriad of services and behavioral health supports to address those concerns. In fact, over-policing people with mental health issues and substance abuse issues has been proven to add extra strain and hardship on police departments across the country, not improving public safety for anyone, and most certainly putting law enforcement in an unwinnable situation. According to the Bureau of Justice Statistics, Special Report 2006, contrary to the belief of some, jails and prisons lack the policies and staff trained in behavioral health to deal with the needs of a person with behavioral health concerns, particularly someone who is in crisis. And post-release adverse effects include difficulty finding employment, higher risk of homelessness and rearrest, and interruption in Medicaid and other benefits. That does not make your family any safer. That does not make my family any safer. It is widely believed that they will receive the treatment, it is widely believed that they will not receive the treatment they need in prison or jail. And the truth of the matter is, prisoners who had mental health problems, only 34% in state prisons receive the treatment after admission. 24% in federal prisons, 17% in local jails. And these are 2006 stats. And the reason why I wanted to go back to use data that was a little dated is because we're trying to prove and demonstrate that over-policing has never worked to address the issues that exist in the current crisis in the Tenderloin. And the way each community defines safety must also be looked at. Some people feel safer with additional police, while some people want to address the root causes that lead to crime, drug abuse, and violence. We know that we must be strategic in how we deliver a budget that promotes safety for all San Franciscans. I'm committed to listening to the communities that have been most impacted by drug abuse, that have been most impacted by crime, that have been most impacted by violence. And we have a lot of work to do, and I hope you all will join me in addressing safety for all. But let's just talk a little bit about facts and community dynamics. The city's budget is created by the mayor, and the Board of Supervisors deducts or adds. The mayor could have chosen to try and add money to the police budget, but along with me and my colleagues, the mayor knew the importance of investing in the Black community and in communities of color, and responding to the COVID-19 pandemic, and working to eliminate the root causes of crime and violence. And we did not take one officer off the street. As a D10 supervisor and the only Black supervisor, I have to add that our communities have not forgotten about George Floyd, Breonna Taylor, Mario Woods, Oscar Grant, and many people who have been killed at the hands of law enforcement. We do have a public safety problem here in San Francisco. That's why my office has had a complete public safety plan in place for over a year. Developed with community, developed with law enforcement, developed with the people who are concerned about keeping people safe. But we've had 16 homicides in District 10 this past year. Where's the outcry for that? We need resources to prevent crime and alternatives to policing to do that. We have asked for increased foot patrols in the Southeast sector, along with law enforcement. We did that together, which is just one part of the solution. We need to fight desperation and despair. Historically, we know that a police state does not work and only exacerbates mass incarceration for Black people, for brown people, for people of color, disproportionately. Now, this doesn't fit neatly in today's conversation, but it most definitely is related to proposed strategies to address crime, drug addiction, and violence. But are we saying prioritizing corporations and protecting them over human life is the right value? We have had 2 homicides alone in District 10 in the past couple of weeks. Where is the outcry over that? The media will show looting, but won't show the devastating impacts of losing a child. We cannot say protecting corporate interests over human life is our priority. Protecting children, families, and communities must come first. We must do better at protecting and creating safety, not just in one area, but in every single community throughout San Francisco. I can't look a mother in the eye, look a father in the eye, who has lost a child to violence, and in the same breath say, stopping looting is more important. I cannot say public safety in only one community is more important than another. I know that we cannot turn a blind eye. We must address all safety issues, with life being most important. Lastly, locking people up for addictions and mental illness has never worked in this city or anywhere else. We need to support mental health SF and see it to full implementation. Resources need to go towards all strategies to stop crime and violence, and all strategies to address behavioral health, substance abuse, and mental health needs. We need to expand evidence-based programming and alternatives to policing for people who use drugs. Starting today, let's all work together towards citywide solutions. Let's fight for safety together across all of San Francisco. Let's make San Francisco safe everywhere and for everyone. Thank you.
Next, we'll have up Public Defender Mario Rossi.
Good afternoon, everyone. San Francisco Public Defender Mano Raju, and I'd like to first lift up the words of Bell Hooks, who passed last week and is an inspiration to many of us. Because she never talked about accountability without also asking the question, at the same time, how do we remain in touch with people's humanity enough to believe in their capacity to be transformed? At the Public Defender's Office, we know that truly seeing someone has an impact. We know that a client saying to us, "You fought for me. I know there was someone in my corner who cares," has an impact. We litigate to protect due process rights and to avoid wrongful convictions. But we also do much more than that, because we know that from that place of trust, when done right, comes tremendous possibility. We're the last ones, after we fought for someone's freedom, who want to see that person slip back into the system. The last ones who want to see that. That's why we try to work to facilitate job opportunities. That's why we work to facilitate educational possibilities. That's why we work to facilitate shelter and housing. That's why we work to facilitate culturally competent and diverse counseling. And that's why we as the city have to continue to fund and support those efforts. From that position of trust that we try to hold as public defenders, in conjunction with community and community-based organizations, we have seen truly positive impacts. And those impacts can be deepened if funded further. Employment, housing, financial stability, and family well-being are deeply impacted by incarceration. And we know that each conviction has an impact not just on that individual, but on that individual's family, that individual's community, and even generationally. We have a pretrial release unit that is now going to finally be able to hire a couple case managers, but it's only 2. And that's not enough. But the goal there is to immediately assess people's needs and see, what does this person need? Is it a class at City College? Is it a coach? Is it substance abuse counseling? Is it a place to sleep the next night? Is it anger management? What is it that that person needs? Meeting people where they are and finding solutions can have real impacts. We also have a clean slate program, because we know that getting people off paperwork, getting people off probation, getting their records expunged is the most important thing to connect that person with jobs, which then ends up lifting economic opportunities, not just for that individual, but for their whole family. We have higher goals than just providing services. We want to push to enable lives of dignity and to facilitate our clients getting their lives to the next level. And we know that it can happen. There's a former client of mine that I see around the office who now works for THC, Tenderloin Housing Clinic. And every time he sees me, he says, you believed in me. Thank you. Thank you for believing in me. And I work with an office of believers, and I know there's a lot of believers here in this room flanking me and in this city. And I know that when we believe in believers, when we fund believers and community, and when we fund the connectors and the facilitators to connection, to communities of care, meaningful change can and does happen. And we've seen it time and time again. And you know what? When that happens, we're all safer, we're all healthier as a community, and thriving for communities is truly possible. And that's what we stand for today from the Public Defender's Office in collaboration with community. We're really looking forward to the city moving in that direction. Thank you.
Next up, our district attorney, Chesa Vadiki.
First of all, I just want to thank everyone standing here with me today for coming out, for doing the work day in, day out, for caring about these issues. Particularly want to thank President Walton, Dr. Eisen, all the speakers, Gary McCoy from HealthRIGHT 360 for bringing us together, for organizing this event, and critically for the work that HealthRIGHT 360 does all day, every day across this city and across this state. Look, all of us here today, and everybody in this city shares the frustration. We all share the concern and the pain about the situation in the Tenderloin. Personally, I am outraged every single time that I walk or drive through the Tenderloin. The raw human suffering, the flagrant violations of law, the neglect, and the circumstances that we see that are going in direct violation of our most basic core human principles about caring for others in need. The Tenderloin is where our city's most vulnerable residents live. It's where we have the highest concentration of families with children. We know that many of these families are raising children in conditions that are truly unthinkable. Now, the Tenderloin has sadly always been a place with many of these problems. These problems are not new. And as a result, we also know what will not work to solve them. We must respond aggressively. And we must recognize that COVID-19 has made things in the Tenderloin far worse than it's ever been. So what does an aggressive response look like? What does it look like to respond with the urgency that the situation clearly demands and requires of us? What does it look like to ensure that everybody in the Tenderloin is and feels safe? I want to be really clear. Arresting people who are addicted to drugs, jailing people who have mental health struggles, putting folks who are vending hot dogs or other food on the streets in cages will not solve these problems, and they are certainly not the only tools available or the only options available to us. The truth is that there are many options available, options that we know can and do work. We need to invest in them. We need to make them happen, not only for the Tenderloin, but for all of our safety. Now, before I took office, the legislative analysts at the Board of Supervisors issued a report that found 75% of people booked into our jail were drug addicted, mentally ill, or both. To build safety and to prevent crimes, we need to attack these issues at their roots. We need to remember that about 35% of the people in our county jail right now as we speak are unhoused. They don't know where they're going to go. We don't know where they're going to go when they get released. That makes all of us less safe, especially when, as is all too often the case, they're released at 10 or 11 or midnight, when any available shelter would be closed, when any available treatment options would be shuttered. We know about these problems. They are not new problems, and we must address them if we are serious about safety and if we are serious about justice. We have to ask ourselves the question about whether or not the crimes committed or alleged to have been committed by the 35% of people in our jails who are unhoused could have been avoided if they had a shelter over their heads, if they had a place to go before they were arrested. Right now in San Francisco, it is easier to get high than it is to get help. That must stop. That must change right now. We cannot simply arrest and prosecute our way out of the problems that are afflicting the Tenderloin and so many parts of our city. We can't continue to wait for police to respond and make an arrest before we intervene. We must, as a city, we must intervene before crimes are committed, before damage is done. We need real, urgent investments in our public health system. You heard President of the Board, Walton, talk about mental health SF. You've heard others today talk about the need for expanding universal access to mental health care and about safe consumption sites. We know from the experience in just a couple weeks in New York City that safe consumption sites can and do reverse otherwise lethal overdose. They save lives. They save lives, and that is exactly what needs to be our priority. So I'm here today to urge solutions like housing and safe consumption sites and expansion of health services, solutions that can and will work to promote public health, to ensure public safety, to respect the humanity of every single person in San Francisco. I share the sense of urgency. I will do everything in my power to make the Tenderloin safe for all of San Francisco. Now, I want to talk for a moment about what the role of my office is, what the role of the district attorney is. Why am I here with so many healthcare providers, and folks with different backgrounds and different lenses on these issues. We have a critical role to play, but we cannot do it alone. If arrests and prosecutions alone could solve the drug crisis in this country or in this city, it would have been solved long ago. You heard Supervisor Walton's statistics from 2006. We have invested over $1 trillion in fighting the so-called war on drugs, and where has it gotten us? What do we have to show for it? Now, I'm going to share a statistic that some of the folks behind me won't be happy about, that some of you won't be happy to hear. But this is what the data shows. In the last 2 years, under my leadership, the District Attorney's Office has filed felony drug cases in over 70% of the cases that the police have brought us. Over 70%, that's higher than in 2018 or 2019. What do we have to show for it? Has it improved things? Has it solved the problems? No, we know we cannot lock our way up out of addiction. We know we cannot use jails as an alternative to meaningful treatment or shelter or housing. We've seen that time and time again, and that's why I have also prioritized alternatives to incarceration, our collaborative courts, our treatment courts, where we connect people who've been arrested with desperately needed services, where we address root causes of crime. We've significantly expanded these courts because we know that when we are able to connect people with services, we not only save their lives, but we build safer, more vibrant communities. We don't only affect those that have been arrested and accused of crimes, but their entire family and neighborhood and community. All of our communities can benefit when people who suffer from mental illness get treatment, when people who use substances in ways that are dangerous get help. That is a priority for me when it comes to public safety, and it should be a priority for this entire city if we care about justice and health and safety. But the problem is we don't have enough facilities. We don't have enough beds. We don't have enough resources. We can increase the use of our collaborative courts all we want. The city can apparently turn on a dime and invest tens or hundreds of millions more in policing. But where are the treatment facilities on the back end? Where are we asking our judges to send people so they can actually get well and change their lives, so they can get off the street and on their feet? We know that people sometimes wait for months in our county jail just to be placed in an appropriate drug treatment facility, even after it's been so ordered by the court. And it's even worse for those that have limited English language skills or who have dual diagnosis. So we need investments. We need investments from the city, from the Board of Supervisors, from the mayor, and I stand committed to work with all those who in good faith come together to really solve these problems, to address them at the roots, to do what we know, what science shows and empirical evidence and research shows needs to be done, with all those who refuse to double down on the failures of the past, but instead to invest in a shared future. I share the outrage. I feel the sense of urgency. The time is now. We must act. We must use every tool in our tool belt, every weapon at our disposal to address this crisis. The safety of San Francisco and our very souls depend on it. Thank you.
We'll bring up EOL Haile with the ACLU.
Good afternoon. My name is Yoel Haile. I'm the Director of the Criminal Justice Program at the ACLU of Northern California. Residents of the Tenderloin deserve a humanitarian response to the public health crisis that has been going on in their neighborhood for decades. The public funds that Mayor Breed intends to funnel to police departments will be better spent by addressing the root causes of crime and significantly expanding violence prevention programs, mental health services, affordable housing, and other programs that directly address the grotesque racial wealth gap, poverty, and despair that we see in neighborhoods like the Tenderloin and others throughout the country. Recent calls by police associations and public officials to increase police funding are part of a coordinated backlash to last year's movement to end police violence and misconduct after the murder of George Floyd. And they directly oppose the nationwide call to defund the police and invest in communities. Decades of data, as has been mentioned, shows that increased policing, surveillance, and incarceration do not solve these issues that we've been talking about. Instead, they bring long-term consequences and suffering that fall heaviest on poor, underserved, and over-policed communities of color. What creates safe and healthy communities is affordable housing and healthcare for everyone, good education, gainful employment, and other supportive services. The failure of the government to guarantee these things has created the very crisis and suffering that we have been witnessing for decades. The idea that police and incarceration create safe and healthy communities is a false equivalency. If that were the case, with over 2 million people in cages and incarcerated throughout the country, and billions of dollars spent on policing every single year, this country would be the safest and healthiest country on the planet. Clearly, it is not. The ACLU will monitor the situation closely to ensure that everyone's constitutional rights are protected. Let us be clear that an emergency declaration does not mean the police get to violate your constitutional rights. We will not stand for any form of racial profiling, illegal use of force, or violations of due process by the police or any other city entity. Thank you.
Del Seymour, founder of Tenderloin.
Good afternoon. I've been in the Tenderloin 35 years in all kind of different ways. Had my own tent, had my own dumpster. In the war on drugs in the late 90s, I was arrested 12 times, which made me no less of a dope fiend until I got drug rehab. So, I look at this proposal and I hear the same thing from every one of these speakers here. I'm a licensed electrician. I would never fix that wall switch with a pipe wrench. And that's what we're doing here in San Francisco. We're fixing a wall switch with a pipe wrench. Has it worked here? Has it worked anywhere in the nation? The war on drugs only made victims. Now I'm a victim with 12 felonies on my record that I can't get rid of. So I walk to Tenderloin every morning. Walked it this morning. I had a missed meeting, so I had an extra hour, so I really walked it, especially with this meeting here in mind. There's misery out there. The folks that are on our streets will be the collateral victims of this emergency declaration. I really believe that. Most of the people I saw this morning look like me. Most of these people I saw this morning were my age. I ain't gonna tell you how old I am, but they were my age. They will be collateral victims of this. I've been working with groups in the Tenderloin for the last few years, trying to establish our name, clean up our image, make this a place for you all to come, make the Tenderloin a destination no different than Union Square, Noe Valley. And it's been a hard fight to do that. Now the city has come out and declared it as a state of emergency. Who's gonna bring their kids to a neighborhood that's been declared a state of emergency? We didn't have no tornado. We didn't have no fire that I know of. Why are we being branded? This brand we'll never get rid of. I love this mayor. I respect her. I'm actually one of her political appointees. I think she's one of the smartest mayors in this nation. But this may not be the way, Madam Mayor. We got about 70 police officers rolling through the Tenderloin on any given day that don't have a clue on how to deal with the homeless, the drug addict, the drug dealer. Now you're going to add another 70, so now we have about 140 personnel that don't know how to deal with the people on the streets except arrest them? No, Ms. Mayor, no, we deserve a whole bunch better than that. The funding that you are going to spend on this could be well spent on drug counselor, treatment on demand. If you want to bring a better about yourself, we got a wonderful organization that you are very full support of, Urban Alchemy. Double those brothers and sisters who are on the street, who have had a wonderful way to deal with our citizens in the Tenderloin. And I beg you, Ms. Mayor, this afternoon, please refine that approach. It will not work. Thank you.
Laura Thomas with the San Francisco AIDS Foundation.
Hi, my name is Laura Thomas. I'm the Director of Harm Reduction Policy at the San Francisco AIDS Foundation, and we're also a member of the Safer Inside Coalition. My favorite 7-year-old has been in Zoom school since the pandemic started, and she had a teacher named Teacher Libby, and Teacher Libby has a rule that is posted in large letters above her desk. And Teacher Libby's rule is don't solve a problem in a way that makes a problem for someone else. So these are words that we should all be living by. Clearly what is happening in the Tenderloin these days consists of a large number of problems, but the ways that we solve them can't make things worse. And that is the direction that we are going with this state of emergency. The San Francisco AIDS Foundation is proud to partner with the city and with the Department of Public Health to provide an array of services. We are proud to run one of the largest syringe access programs in the country. We are extremely proud to be the largest single distributor of naloxone and overdose education to people in this city, primarily getting it into the hands of people who use drugs, many of whom live in the Tenderloin and South of Market. And we're very proud that those individuals are reversing thousands of overdoses every month. However, that comes in the context of this huge and increasing overdose crisis here. We all know that over 700 people died of drug overdoses last year. We're on track to hit over 1,000 overdose deaths this year potentially in the context of 100,000 people dying of overdose in the United States last year. We can and should be doing more to stop this. Overdoses are indeed a true crisis and an emergency. We went to the Board of Supervisors asking for the mayor to declare a public health state of emergency related to overdose, and then to use that to open supervised consumption services. You heard our district attorney previously mention them and mention that they've now been opened in New York City, where they have saved, at last count, I heard 35 overdoses had been reversed in the first 2 weeks that they were open. That is what we can and should be doing here in San Francisco. We know that there are things that we could be doing that will work, that will not cause problems for other people. We are leaving federal dollars sitting on the table instead of keeping our shelter-in-place hotels open with housing for people who want housing. We are leaving mental health SF and Prop C money on the table and not investing it in new mental health and substance use services as we should be. We're leaving ideas and proposals like CART on the table and not starting up community response teams. And most importantly, we're leaving supervised consumption services on the table. We know that they work. We know that they save lives. They don't, however, work in a context of increased enforcement and criminalization. They are the opposite of criminalization. They are about connection. They are about safety. They are about wellness. Nobody who is living in the Tenderloin or anywhere in this city wants to be using drugs outside. If people are using drugs outside on the sidewalk, it is because they don't have an alternative and safer location. And that is something that we can and should be providing. At the San Francisco AIDS Foundation, we are committed to expanding evidence-based interventions in the public health field, such as PrEP or naloxone distribution or contingency management. And our vision is a vision of health justice for all, striving for a day when race is not a barrier to health and wellness, when substance use is not stigmatized. This is where we are going, and we call on the city to go with us, to follow the evidence, to follow compassion, to follow the lead of other cities such as New York that are moving forward with efforts that will prevent death, that will address the emergency. We know that increased policing, aggressive policing, does exactly the opposite. The evidence has shown that aggressive policing increases overdose deaths. It increases HIV and hepatitis C transmission. The more we throw police at the Tenderloin, the more overdose rates are going to go up. We also know that incarceration increases overdose rates. If people are released from jail, that first 72 hours after jail is the most vulnerable time for an overdose. The same as if people leave treatment without options such as aftercare and housing, they're vulnerable to overdose. So we know what works and we know what doesn't work. And it is unconscionable for this city to be doubling down on the things that do not work and that will increase overdose deaths in this city when we have the options to be doing the things, to be investing in the services, in the interventions, in the policies that will prevent overdose deaths. We have a saying that every overdose death is a policy failure. Certainly every increased overdose death because of this doubling down on police is not just a policy failure, it's a human and it's a moral failing. We can do better. We're San Francisco, we know how to do better and we can do better. Thank you.
And we'll close with Brooke Lober with St. James Infirmary.
Thank you. Thank you, Gary, for having me here, and thanks to everyone who's spoken today. I appreciate being able to take a moment to reiterate everything that's already been said. Mayor Breed's emergency proposal to increase the presence of police and the nonprofit security firm Urban Alchemy in the Tenderloin and Civic Center is a proposal for the violation of human rights and violation of basic compassion for our neighbors, our fellow residents of San Francisco. It prescribes a punitive response to public health problems that will only be further intensified by policing displacement and the threat of incarceration. As the Director of Harm Reduction at St. James Infirmary, I guide a team to offer syringe access and harm reduction services to hundreds of Tenderloin residents every month. We distribute hundreds of units of Narcan every month to scores of residents who report back to us that they have personally reversed overdoses every month. I know from our program participants that the current conditions of repeated sweeps of unhoused people and constant harassment and control by Urban Alchemy and police officers are already traumatizing, and the mayor's threat of a renewed police occupation of the Tenderloin is already sowing fear and causing harm. There is a crisis of poverty, addiction, and health inequity, including an increased overdose risk for the most vulnerable people who use drugs, mostly poor people and people of color. This crisis is the result of a social structure that imposes racialized poverty, violence, and the trauma that can lead to addiction and health outcomes, including increased prevalence of HIV, hepatitis C, and overdose. In fact, the overdose crisis will only be exacerbated by increased policing and a renewal of the war on drugs, as all evidence shows. A destabilized drug supply is more dangerous. More raids are more dangerous. The way to prevent overdose is to destigmatize. That means don't call them zombies. Destigmatize. Decriminalize. Ensure safe supply. And increase access to effective, dignified service options. The current situation is killing the most vulnerable people. The city's overdose crisis, as you all know, is most pronounced in the Tenderloin, where more than half of all residents are people of color, live in poverty. More than half of my program participants are Black. This is the community of people who use drugs, who have reversed 6,000 overdoses this year and counting, a community in need of real support, real care. A police occupation of the Tenderloin, increased surveillance and police powers to collaborate with DPW might move people elsewhere, but it will not address root causes or address current social ills with compassion. It cannot address the poverty that continually reproduces an informal economy, petty theft, and even violent crime, let alone addiction, which is rooted in trauma. The only way to mitigate the harm that can arise from the conditions that beset the Tenderloin is to offer dignified housing options, housing first, housing for all, job opportunities, low barrier entry to educational programs, and access to equally low barrier healthcare, including mental and emotional health services, and for people who use drugs, decriminalization, harm reduction, and easy access to a spectrum of treatment options from medically assisted to other forms of recovery services. Finally, I just want to make one more point. The infrastructure to offer the level of services that would indeed clean up the Tenderloin, as everyone seems to desire, actually already exists in the network of underfunded, overworked, community-based organizations that have to fight for support from the city and other state agencies to even continue to exist. Further criminalization will impede our work. Criminalizing homelessness, criminalizing people who use drugs, and all low-level broken windows policing will increase terror in our communities. We are waiting not for the arrival of shock troops, but for increased funding and support, an atmosphere of care and compassion, not punishment, to do our work. Thank you.
All right, thank you everyone for coming.
No, it was neat, so.
You know, Rachel,
Thank you.